Hello, everyone. My name is Noor Majdalawi, and today I will be presenting my research proposal titled Enhancing Radiology Education Through Virtual Simulations, a study on long-term clinical performance and hybrid learning models. Introduction to the research. Radiography is a unique field that demands both deep theoretical knowledge and highly developed clinical skills. Traditionally, radiography education has relied on physical labs and clinical placements. However, these approaches face several challenges, like limited access to clinical sites, safety risks due to radiation exposure, and high costs for equipment and staffing. Virtual simulation is emerging as a solution. It provides students with a safe and repeatable environment to practice clinical skills such as patient positioning or image interpretation. This study investigates whether these tools can improve long-term clinical performances and how they can be integrated into hybrid learning environments. Research problem and gap. While the benefits of simulation have been documented, most studies focus on short-term outcomes like improved confidence or test score. However, what we really need to understand is whether these gains translate to long-term clinical performance. Also, while hybrid learning models are gaining popularity, there's little guidance on how to effectively blend virtual simulations with in-person training. That's the gap this research aims to address. Research purpose and questions. The purpose of the study is to evaluate the impact of virtual simulation on long-term clinical performance and provide insights into integrating these tools within hybrid learning models. My research will address three primary questions. One, how does virtual simulation affect long-term clinical performance? Two, which simulation tools are most effective for teaching essential radiology skills? And three, how can hybrid models best integrate virtual simulations with traditional clinical training? Theoretical framework. This study is grounded in constructivist learning theory, which argues that students learn best when they actively construct knowledge through experiences. Virtual simulation aligns perfectly within this model. It enables students to make decisions, see the outcomes of those decisions, and reflect on their performance in a low-risk, interactive environment. As Williamson and others suggest, this type of experimental learning is essential in health education, especially in radiology, where hands-on practice is very critical. Literature review overview. The literature review centers on three themes: the effectiveness of simulation for skill development, student engagement with virtual tools, and the role of hybrid learning in healthcare education. Research by O'Connor and others supports the idea that simulation improves readiness, technical accuracy, and satisfaction among students. Simulation enhances clinical readiness. In a meta-synthesis, Hazel and others found that virtual simulation significantly improves clinical readiness. Students trained in simulation environments demonstrated stronger technical skills and reported feeling more prepared and confident when entering clinical placements. This shows that simulations offer a practical way to gain competence before facing real-world situations. Simulation improves diagnostic reasoning. Elendu and others explored how simulation affects cognitive development and decision-making in clinical settings. They found that students using simulation tools showed marked improvements in problem-solving and diagnostic reasoning. These benefits are essential for long-term clinical success and suggest that simulation could influence how well students perform months or even years down the line. Gaps in integration of hybrid models. However, studies by Shetty and others prior to a significant issue, while simulation tools are available, there's no standard for how to implement these within a hybrid curriculum. This lack of structure can lead to inconsistent outcomes, making it harder for institutions to adopt best practices. More research is needed to develop effective integration models. The mixed method research design. This will be a mixed method study combining both quantitative and qualitative data. The goal is to measure actual performance changes through tests and skills assessments, as well as gather students' experiences and perspectives through interviews and reflective surveys. Using both data types ensures a more holistic view of the impact of virtual simulation. For quantitative data, students will complete pre and post simulation assessments. That means knowledge, skill acquisition, and clinical judgment. Qualitative data will come from semi-structured interviews and open-ended survey responses that capture students' perceptions, challenges, and reflections of the learning experience. The participant selection. Participants will include first-year radiography students from a range of programs, such as the certificate, associates, and bachelor's, ensuring diversity. A stratified random sampling method will be used to create representative groups. I aim to recruit about 100 students with in-depth interviews conducted with a small subgroup of 20 to 30 participants. Data analysis. Quantitative data will be analyzed using statistical tools like regression analysis and pair t-test to detect significant improvements in clinical performance. Qualitative data will undergo thematic analysis to identify recurring patterns and insights. Both data types will be integrated through triangulation, increasing the study's validity and depth as supported by Zoe and others. The ethical considerations. The study will follow ethical guidelines and receive IRB approval. All participants will provide informed consent and be reminded of their rights to withdraw at any point. Confidentiality will be strictly maintained and data will be stored securely to protect participants' privacy. Expected outcomes. Based on current literature and the study design, I expect to find that students who use virtual simulations will show improved clinical performance, especially in areas like decision-making and patient positioning. These students will likely report higher confidence and better long-term retention of skills. Additionally, the study will help identify best practices for hybrid integration, making future curriculum development more efficient and effective. Implications for practice. If successful, this research could provide clear guidance for curriculum designers, helping them choose the right simulation tools and teaching strategies. It could also support programs in low resource areas where clinical access is limited by offering an alternative pathway to hands-on learning. Ultimately, this could improve educational equity and enhance outcomes for students across different settings. Conclusion. In summary, virtual simulation offers a valuable supplement to traditional radiography education. By addressing gaps in long-term performance data and offering a model for hybrid integration, this study has the potential to transform how we teach clinical radiography. Thank you for your time and attention. I look forward to sharing the results in the future. Here are some of the sources that were used within my study.